Hey, good afternoon. My name is David Baden. I am the Chief Financial Officer here at the Oregon Health Authority. I'm joined by Lori Coiner today, the State Medicaid Director. Welcome to what really is our third provider webinar, but this time we're going to focus specifically on Jackson County and invited a group of providers, and happy to see a lot of providers joining from Jackson County so far, and look forward to a good discussion on where we are at in CCO 2.0. Happy New Year, everyone. Welcome to CCO 2.0. Look forward to working collaboratively to meet the policy goals laid out. So in addition to Lori and myself, we also are joined by the two CCOs that provide services in Jackson County. AllCare has Will Brake and Sheila Anders joining, and they'll speak later in this webinar. And Jackson Care Connect has a group of folks, Tracy Madej, Darren Brink, Bingbing Langs, Sun Sonoan, and Daniel Berzaga. So welcome everybody, and we will get started. Just again, encouraging everyone, if you do have questions, you should be able to be in the webinar, and please submit your questions through the webinar. We will, as we get those, we will log them and hold them toward a Q&A section and get to all of the questions that we can get to in the hour that we have set aside for this discussion. With that, let me briefly go through an agenda. So what we want to cover today in our hour-long webinar is just provide a 2020 member transition review and update, a brief discussion about what member and provider communications have occurred to date, a reminder of the continuity of care provisions that are out there, and just assuring that Medicaid members are getting services pretty much regardless, and where there are questions or concerns, where to deal with those. How we're working with CCOs as we move into CCO 2.0, specifically talk about changing plans in 2020, how you can help. We'll have each CCO talk a little bit about their portions, and then we'll go into a Q&A. All right, so I'm going to kick it over to Lori Coiner, who's going to talk a little bit about the goals of CCO 2.0, and then we'll sort of trade back and forth on a variety of concepts. All right, Lori, over to you.
Hi, everyone. I'm going to start by talking about the kind of initial high-level goals of CCO 2.0. There was a letter written by Governor Brown that established the high-level vision for CCO 2.0, and the goal of it was to build on the strengths that we learned in the CCO 1.0, or the first 5 years of our CCO model. And so the four big areas of focus in this next 5 years are to improve the behavioral health system, focus on social determinants of health and health equity, maintain sustainable cost growth, and increase value and pay for performance. So we will be focusing in these areas. You may have already had CCOs contact you about things such as value-based payment. The contracts that we have with the CCOs establish many of these parameters, so the CCOs will then be working with their provider groups to focus in these particular areas. The guiding values for member transition are focused on being very patient-centered or member-centered, and many of the decisions that we made across time to develop our member transition period were focused on trying to minimize the disruption to members. We've done lots of work across the fall to inform members about upcoming changes, particularly in those counties where there's more than one CCO or things changed, you know, if a CCO left or a new one was coming into that county. And we are attempting as much as possible to honor member choice in terms of what CCO they want to be in, if in fact there is a choice, or they're in what we call a choice area. And our big goal across the next coming months is a seamless transition for those members that do switch from one CCO to another.
All right, and again, I think why we're focusing on Jackson County in particular is because we recognize that that there have been changes as we move into 2020 around CCOs that were available in the area, and some big provider group changes as we move into this new contract year. So the first piece on here is around the closure of primary health in Josephine, Jackson, and parts of Douglas County. So again, to Lori's point, obviously really focusing on seamless transition of those members that moved or had some choice in movement from primary health into a new CCO, and that's been a really strong focus, working closely with the primary health team as well as All Care, Jackson Care, and Umpqua as needed. So just also wanted to provide a quick update from our last webinar. So we had initially awarded, based on some concerns we had with the applications that were submitted by 4 CCOs, that the applications that they provided did not provide enough detail and clarity about all the plans in place to meet the goals of CCO 2.0. So we worked closely with those 4 CCOs on a remediation process to assure that it wasn't just bad writing in applying for the RFP, but assuring that they do have appropriate plans in place. And I'm happy to say that all CCOs now have been awarded 5-year contracts. So as you can see, that includes All Care in this area. And just to reiterate, All Care has a 5-year contract, just like every other CCO now in the state. Okay, so just a quick sort of follow-on that of what that means on provider network changes and member reassignment. So the extra challenge, and again, why we probably are having a webinar in Jackson County, is a change in some big provider groups' contracting status for primary care that really changed some of the core primary care network in the county. And so due to that change, we reran our reassignment algorithm. And, as a reminder, that algorithm looked a 2-year look back on claims data to look for primary care and primary behavioral health claims, and matched those members to the CCOs where providers were contracted with. So in Jackson County, what that meant is that the network changes and provider groups that changed their contract status, that meant that 12,000 All Care members who, again, through our algorithm process, were better matched to Jackson Care Connect, is that they were moved and received a letter that said, due to these changes in provider contract status, that they have been moved over to Jackson Care Connect. It also gave those members instructions on a number to call or a website to go to if they wanted to change back to All Care. They didn't need to do anything if they wanted to stay with Jackson Care Connect, but that's the period that we're in now, of January to March, for those members, and then also members in primary health of Josephine County zip codes in Jackson County, for those members to make changes. So just one quick also reminder, and this one has come up in questions along the way. So as we were putting together our original decision around who should run through this algorithm, as I talked about, based on 24 months of claim history, we want to take special care for what we sort of determined are members in special populations. And those populations include members who are duly eligible for Medicare and Medicaid, members enrolled with the Office of Developmental Disability Services, children and youth enrolled in the child welfare programs, and children and youth enrolled in Oregon Youth Authority programs. So many of those programs have different requirements for how changes can be made to those specific members. And so running them through an algorithm would not have made sense. Plus, we really wanted to, where possible, assure that those members had the best continuity of care possible. I think as we move into 2020, I know this is a really strong focus of all parties involved to really assure that all of those special populations are able to see providers and keep their care continuous. That may mean that they need to switch CCOs. That may mean that they just potentially would switch providers to keep going through that care. We've asked All Care and Jackson Care Connect to pay particularly close attention to these populations, and would ask all providers to do the same. These obviously can be some of the more vulnerable populations in the state, and we want to assure that continuity of care is tantamount in keeping them going.
There have been some questions about how to communicate with members, and both in just verbal conversations and written material, and particularly for members that have a choice or are in a CCO choice area. So this slide just lays out some guidance that I'll walk through. The key piece on marketing is that it would be considered marketing if you're using wording that urges or directly asks a member to change a CCO. So that shouldn't be the kind of discussion that providers or CCOs are having with a member. Instead, the way to talk about it is, I'm a provider that is contracted with this CCO A and not CCO B, and then the member can choose. If the member asks how to make that choice, and certainly you can provide information on the web, to go to the website to make the change, or to call the call center. So the kinds of language that causes a problem, here's an example in the middle of that slide that says choose CCO Y so you can get your care with provider X. So that's directing a member to a particular CCO. The other thing is, if you have printed material that has that kind of wording, or wording about CCO selection, then submit that to the CCO that you work with, and those materials need to be approved by OHA, or reviewed and approved by OHA before they can be distributed in your clinics. If you're using OHA Pick Your Plan images, those are the Pick Your Plan documents went to members in the fall and through December. Then just make clear that the document's not produced by OHA, but you've used the images from those documents. If there's additional and guidance that is a little bit more detailed than what I've gone through here on the OHP provider CCO 2.0 pages. And so, and if you Google provider and OHA CCO 2.0, it should take you there. I'm going to walk through some issues where we know people have questions on continuity of care, and so we'll talk about that in the next couple of slides. We've gone through this in the prior webinars, but wanted to reiterate what the continuity of care guidance that we OHA has given to CCOs. So for prior authorizations, prior auths that were approved, say in December, CCOs need to honor approved prior authorizations for up to 180 days or until June 30th, 2020, regardless of whether the provider is in the network. So if a member switched to CCO, for example, and they had a prior authorization that was approved in December, then the new CCO needs to honor that, and there's no need to have to go back through a prior authorization process for that member. Physical health providers have 90 days where members can see their current PCP. That would be through March 31st, 2020. And in some subsequent slides, we'll talk a little bit about how to do the billing on that. But this is to ensure continuity of care, and we'll also talk about the length of time it takes from when a member goes to the website and switches. There's going to be a week or sometimes a little bit longer before that member officially switches, and that member still should be able to see their current PCP during that intervening time. And then finally, for behavioral health providers, members can see their current behavioral health provider for 180 days through June 30th, so that they have time to transition to a new behavioral health provider if their new CCO has a different network. These timelines are in the CCO contracts with us, and so it's an expectation that we have that the CCOs will be making payments during these transition period times. We wanted to just reiterate a couple of key timelines that relate to the January 1st transition. So members were should have been contacted in December about any current needs and how have pre-approved services or behavioral health services and kind of what the timelines would be. Members should have all been assigned and notified about or assigned a primary care provider by January 5th. And then by January 14th, so yesterday, members should have received their welcome packet that includes their ID cards and the provider directory for their new or existing CCO. By January 20th, CCOs need to complete their contracts with the members' existing providers to ensure continuity of care until at least July 1st. These may be contracts, they may also be single case agreements, but some sort of agreement so that the providers get paid and members can continue seeing their current provider during the transition time. I want to make sure that all providers are aware that members should not be billed. OHP members from any CCO should not be billed for services. We expect to have all of the plan transitions done by July 1st. So we've got 6 months of transition time. Members have had a number of letters if they have been in a choice area or a place where they were going to have the opportunity to switch CCOs by OHA through letters both in October, and then some members received additional letters in December, I believe. The CCOs were sent their final list of those members in December for their 2020 CCO members. And then, as I said, in December, the members that had any last-minute adjustments or whatever were also sent letters in December. OHA does not provide member lists to providers. So as a provider, if you want to know who's on your panel from your particular CCO, you need to contact the CCO directly. And as I mentioned a little bit earlier, I will be talking about contracting and then billing and payments and how that's going to work in working with your CCOs, both if you've had change in contracting or just your existing or new CCO. So during the transition period, if you have members that are in a CCO that you don't currently have a contract with, we certainly encourage you to consider joining that CCO's network or complete a single case agreement with that patient's CCO so that you can ensure payment and ensure that the patient has continuity of care. We do expect providers to continue to honor the appointments that the members have made and then work with the CCO on how to get payment for those appointments. Contact your CCOs to learn about their systems and policies in order to get any new services approved and how to bill the CCO successfully. If you're not satisfied with your CCO's decision about covered services or provider participation, the first step is to complete an appeal with the CCO. And then once that appeal process has been exhausted, then you can request an administrative review by OHA for resolution of that matter. So for payments from CCOs, I guess I'll reiterate, the payment is a matter between the CCO and a provider and not the member. CCOs must pay or deny at least 90% of all their valid claims within 30 days and 99% within 90 days. And then to dispute a payment decision, as I mentioned, follow the CCO's appeal process, and then you can submit a 3085 form to OHA, and OHA conducts administrative reviews and then makes the final decision from there. CCO, just in terms of reimbursement, CCO shall reimburse a non-participating provider. So this would be, for example, a provider with that sees a member, you're not under contract, at no less than the OHA's fee-for-service rates. During transition, CCOs must approve claims for covered services, even if they have no documented prior authorization. You may, as a provider, negotiate with CCOs for a higher rate than fee-for-service. And if you cannot agree on a rate, then again, you can submit a complaint using the OHP 3258 form. There's a picture of it here on this slide, so you can know what it looks like, and you submit that directly to OHA.
So here's where we are today, which is we're now into January, and we have this period between January and the end of March, as we talked about at the beginning, for members who receive letters from OHA to call and change plans, or potentially go through the regular OHP process for changing plans. So just as a reminder of who this covers, and this is really more statewide, these are the areas where members received letters to be able to call what is a special call center that was set up, and you can see the number and the website that will direct that member to a web form to change CCOs if they so desire. But again, a reminder that members will need their OHP number to change plans. So I guess just a couple quick notes. Again, the letters that were sent out in Jackson County were sent to all of the zip codes, members that were in zip codes where Primary Health was formerly a CCO that provided service. And then letters were sent to those members that were reallocated because of the contract changes that I had mentioned before. And so those are the folks that received those letters and will have this number in their letter to be able to call. That being said, we do want to ensure that there's no wrong door for members if they are concerned and want to change plans. So if a member calls up this particular call center in these areas, we will help them get to the place that they need to go to change their plan if needed.
So I'm going to highlight how long it takes typically for a member to their new choice for their new CCO to go into effect in our system. So if a member goes to the website and chooses a new plan, or calls the call center and asks to have their plan switched, if they do that by Wednesday of a particular week, that change in their new plan would start the following Monday. If they make a choice after Wednesday, so if they make a choice on Thursday or Friday, it would be the 1 week from the following Monday. So it takes a week and a half-ish to have that change. So there is anywhere from 5 to 15-day gap between the time that they make the choice and it comes through our system. After the member makes a change, in about 2 weeks, they'll receive a letter from OHA that says that they have a new plan. It verifies that. It's called the coverage letter. The member's new CCO plan will then send a welcome letter with an ID card and a member handbook shortly after, once they get the information from OHA. There are occasions where an enrollment needs to be completed faster due to a medical need. And so if a member can't wait the days that it's going to take for them to switch, to have that switch go into effect, they can call the client services unit and talk about the medical need and get that change fast-tracked so that they can have the services that they need in a timely way. If a member lives in an area with more than one CCO, they can ask to have their CCO changed at other times. So the normal process would be members can change their CCO one time a year. And right now, if they can, they can change, they can go to the website or call and make a change in their membership. Typically, what we do with members is it's called redetermination. We assess their membership and re-enroll them once a year, and so on a regular process, those members can change to a CCO within 30 days of their initial enrollment if there was an error, or within 90 days for any reason. And then, as I mentioned, they can make a change once a year. For those members that kind of the regular process, once they go through redetermination, they use the OHP client services. The information is here. Right now, we have a separate call-in. It's on those pick a plan letters, and that goes to a call center that is specific to this time where members can change CCOs here over the next 3 months.
And again, just to emphasize, we were going through sort of a couple different processes where members that received a letter got a phone number, plus Lori just talked about the regular process. Again, our call centers are available to assist members when they call in, regardless of what number that they call. So we're just sort of getting a little bit more in the details of what each call center normally would do.
So I'm going to talk about how you can help support members in this transition time. So one of the pieces that we hope that you'll do as providers is assure patients that care will continue and that their benefits remain the same. So they should keep their appointments, they should continue to fill their prescriptions, and help them with their transition. If they have a new CCO, then they need to, contact the CCO to help walk through those transitions. Other ways that you can support the member is to contract with that member's new CCO, or like I said earlier, complete a single case agreement with the CCO so that you can continue during this transition time. The CCO customer service lines help answer questions for members about their coverage and how they can move forward and get services. Please remember that providers cannot bill members for services covered by Medicaid. You'll need to work out payment with the CCO. And then the other big ask on this is to, do not tell patients that you just can't see them and turn them away. We really need to have you help support the member and get the services they need, either by contacting their new CCO or working out an arrangement. We've had lots of questions. Dave mentioned earlier with some of our special populations. I'm going to talk about Medicare and Medicaid members or dual eligibles. Just a reminder, as Dave talked about a little bit earlier, most of the dual eligible members did not receive a pick your plan letter. We opted to keep them in their current CCO if that was at all possible for continuity, so that they would have time to work with their local AAA or APD office, who can help them with their choice counseling and help them make the best choice for them. If a member has All Care Medicare and Jackson Care Connect Medicaid, they can still see their existing PCP that does not contract with All Care. So they'll get their Medicare services from All Care, but if they have that Jackson Care Connect Medicaid, continue to see their PCP that's contracted with Jackson. The only other thing is that in Jackson County, Medicare or dual eligibles can choose any Medicare plan they want, and they can also choose fee-for-service Medicare. So there may be members who have a different plan for Medicare versus their Medicaid.
Okay, this is the part of the webinar that we're really expanding our technological reach and hopefully will work out. So let me ask if Sheila and Will are able to talk a little bit about the next two slides on the all care coordination, sort of in concert with what we have been talking about here at OHA. Sheila and Will, can you take it from here?
Sure. So actually, Amy Burns, who put together, is going to talk on this.
Hi. All right. So we just wanted to let everybody know that authorizations that were approved under All Care transfer with the member, and that includes, as was stated earlier, any authorizations for medications, referrals, surgeries, or DME. NEMT, that's non-emergent medical transportation. Rides are now covered by JCC and TransLink. Now, rides that were scheduled with our vendor, Ready Rides, prior to January 1st, but for January, will be provided by TransLink. However, if you have any questions or if your members have any questions, they can call both All Care or JCC if they're unsure which plan they're on and if they're unsure who's providing their rides. If you call All Care, we can give you all of that information, even if the member is now on JCC. And of course, members who are undergoing any kind of case management or care coordination are able to continue that benefit under their new plan at JCC. If you have a member you're concerned about, if you feel that they need care coordination or they were getting care coordination, you can call All Care. We can always triage and help get that member a warm handoff to JCC. We have provided that service for a number of members that we had under case management already, and we have a great care coordination department here who's been talking quite closely with JCC and Care Oregon. The single biggest takeaway that we want to get across is that it will take some time for all the dust to settle. We have given our authorization data to JCC, but transferring 12,000 members does take some time. So just a little patience there on your part, please. All of those authorizations will be honored. So please do not turn patients away.
And please don't cancel surgeries. We had a couple of cases where providers weren't sure what was happening, so they just canceled the surgery. You can be assured that either JCC or All Care will cover that service, and that will all be sorted out. So please don't cancel any of those. One of the things I want to make sure that the providers know is that All Care does have a contract with Prime Care. We're not permitted to assign members to the primary care. There are no changes in the specialty care arrangement whatsoever. Our Medicare Advantage contract has not changed with Prime Care. We have had some providers turn away Medicare Advantage All Care, and that's not appropriate. That contract has not changed. If the member has Medicare Advantage All Care and All Care CCO, you will be made whole through billing All Care Medicare Advantage, and so those folks should not be turned away either. So this last couple of weeks I've been dealing mostly with providers who are turning away patients inappropriately, and we want to make sure that, just like this slide says, please do not turn members away. We're required to pay for the services for the 90 days, but again, we have a contract in place that will pay you the same ongoing after March 31st. So if you accidentally see a member in May, let's say, you will still get paid the same as you will prior to the end of March 31st because there is a contract in place. That's all we have from All Care.
Okay, great. Thanks, guys. Well, let me turn it over to Jackson Care Connect to take the next slide.
Hi, this is Tracy Muday. I'm the Interim Medical Director at Jackson Care Connect. And I really like to thank Will and the whole All Care team for their help and cooperation during this transition time. They've been great partners and have really gone above and beyond to make sure that any transitions are as seamless as possible for members. Someone else here in our organization described to others, our plan is don't break anything, don't hurt anyone, and I would pass that along to all of the providers. That everybody's primary focus is to make sure that members' medical needs get met first, and then we will do our best to make sure that payment follows appropriately and that providers are kept whole. You can see the slide lists customer service phone numbers for members if they have questions. You can see the regional care team contact information for members or providers that need extra help with coordination of care during transition or just in general. For providers who need communications approved by OHA, they can contact Sarah King-Cole at the email here on this slide, and we can forward those communications to OHA to make sure that you are staying within OHA guidelines for communicating to members. I think that's the majority of what we have to add. I would just say to providers that while we transitioned a large group of members, we expect that there will be continued change in eligibility, probably both from and to All Care and Jackson Care Connect. So just like always, check member eligibility on the date of service. Tell your billing department to check member eligibility for the date of service. And if you get a denial from one CCO because the member wasn't eligible, check and make sure that you're billing the correct CCO. That's all I have to add for now. Thanks.
Great. Thanks, Tracy. All right. Well, we do have a set of questions. So the next part of the webinar will go through and sort of round robin between OHA and the CCOs that are on the line and go through some questions. So I'll start with a couple, and Lori and I will get through the ones that we know the answers to, and then go from there. So the first question that we got, will changes to enrollment show immediately in MMIS, or is there a lag? And so the schedule that we went through should follow it with MMIS as well. That'll follow the next weekly schedule, but at times there may be a lag a little bit, is that it may not exactly show up on that weekly schedule time frame, but it should be when the member switches by that Wednesday and they're moved to that CCO. It should show in MMIS when someone comes in to check enrollment. So it should follow that same schedule. So there's a question that came in about, is it possible to get a synopsis of the algorithm you applied so that we can emulate it? So I'm going to go a tiny bit deeper into the algorithm, and by going a tiny little bit deeper, we are happy to share how we did sort of the member matching between CCOs. But I think at this point, that algorithm and what it was used for probably doesn't make sense as we look further on where members should be going to get their care between CCOs. So again, as I stated up front, we look back at 24 months of claim history for primary care providers and behavioral health providers. We first prioritized behavioral health connections, but then also looked at a complicated set of family match requirements, and just to assure that we weren't breaking up families, to try to keep families together and match to then also the most common provider. So when we look back at that 24 months, if we found sort of a most common provider, that's typically where that match ended up going to, that CCO. But if there was not the most common provider, it looked at some of the most recent, and that ended up sort of driving people one way or the other if there was not contracts between a set of providers and that CCO. So I think, as you can see, is that, it really was used from the OHA end to try to match people and keep people with the CCO that had that provider network. But now, really, in this time period, as people are going in or talking to their providers, and if providers are not in that network, the member or who they're talking to really is driving the ship about where they should make those changes to. So hopefully that answers that one. I'm going to go to you. Do you want to pick one, Lori?
Sure. I have a couple, and some of the answers that I have, the CCOs may want to chime in. So there's a question, after March 31st, does OHA and CCOs still have continuity of care contracts that providers need to honor? And if yes, what's the process? So the primary care continuity of care contracts would end on March 31st. If you're a behavioral health provider, those continuity of care contracts should last until June 30th, and prior authorizations also last for 180 days. Another question came in, if a patient comes in for non-covered services, can we turn them away or bill them? If a patient comes in for non-covered services, and you need to have a conversation with them and let them know that it's not part of their benefit. You cannot bill them until they have signed that they understand that those services are not covered and that they would take on responsibility for billing. So there's a process. You should contact your CCO about that, but there is a process. We hope it's rare, but the member has to be clear that it's not covered and that they're choosing to take on that financial responsibility.
Will and Sheila, let me, a question that had come in for you guys. For members who live in Josephine County but have been seeing providers in Jackson County, what options do they have to potentially continue to see those providers?
So at this time, for the most part, we are moving those members back to Josephine County and reassigning them to a Josephine County PCP. However, if there are unique circumstances with a member that the PCP and the member feel are unique and that it is imperative that the member stay with that provider, we do have a process at AllCare where either the provider or the member can request us to look at this and review it and determine if it's appropriate for that member to stay with that PCP. It goes through our medical director team, and if that's approved, then we reach back out to both the member, the provider, and let them know that we will keep that member with that provider. This is not going to be, we've had some providers ask if they can move all 120 members that way, and the answer is no. These are on a case-by-case basis. I think so far we've approved 6. So it's a small number, and it's, again, unique circumstances.
All right, thanks, Will. So let's keep with a couple more CCO questions. One to either, either and or Jackson Care Connect and AllCare. Will the inpatient notification to the CCO effective at admission be good for members who change CCOs while an inpatient?
The answer is
yes.
The answer is yes. Okay,
so the answer is yes. There we go. We can do simple yes answers every once in a while. Okay.
We're on a game show. Yes.
Exactly. I'm not sure who gets the points though. If a member, not sure on this one, but probably back to our CCO friends, if a member switches from one CCO to another, how long can they use their vouchers with the new CCO? I'm not sure what vouchers necessarily means in that thing, unless maybe Jackson and AllCare, if you guys sort of that rings a bell with you.
Hi, this is Jackson Care Connect, and I'm going to take a guess that the question is related to the Babe Store at AllCare vouchers transferring over to Starting Strong at Jackson Care Connect. And since those are for services that were provided while the members were on their previous plan, AllCare, we are not honoring those vouchers at Starting Strong, but are welcoming people in to start new vouchers and start relationships with the folks at the Starting Strong store. And if voucher meant something different, then ignore that answer.
Okay, thanks, Jennifer. All right, so a couple more questions on our end. If there's a break in CCO's enrollment due to incarceration, as an example, will the person return to the prior CCO? So in the specific incarceration example is that their enrollment is just suspended, so that that person would return to the prior CCO. Now, if there's other breaks in enrollment that sort of aren't incarceration, that may be a different answer. But I think specifically it's a good question on sort of the incarceration piece, and that they will go back to their CCO that they were at before they were incarcerated.
There's a question here. Is there a plan to increase provider services staffing to decrease wait time? We are monitoring the provider services call center wait times. They're actually, I just talked to the manager yesterday, and we're answering in a timely way. We will be monitoring it. They're under 5 minutes on average right now. If it does go up, we have a team that meets weekly to talk about issues, and we'll look at resources at that time.
And again, that remember, to our sort of 2 different call centers. So that was on the the sort of the general enrollment OHP call center?
No, that was provider services.
Oh, that was provider services. Sorry. Yeah. That's what I get for jumping into something that I didn't know anything about. All right. Let me see what else we want to go to. Let me get through a couple that that we don't know the answers to, but just to get them out, and then I'll go over to Lori. So, you know, of the 12,000 members that we had talked about that moved from All Care to Jackson Care Connect, how many are adults versus children? I don't have that in front of me. We clearly could get that information. Not sure how the easiest way to share that potentially, but we will produce a Q&A and can include that question. Anything you have, Lori, that you want to?
Sure. There's a question, is there a plan to address or ensure reliable access to member eligibility information? And the answer to that is that MMIS continues to be the provider source of eligibility. So that there isn't any change there.
Okay, well, there's a question here for Jackson Care Connect. Our outpatient behavioral health clinic, so remember this is from a provider, so a provider's outpatient behavioral health clinic gets lots of out-of-county clients. Does JCC still only require authorization requests after 3 months?
We haven't made any changes to the authorization rules, so yes.
Okay. There's one here about sort of single case agreement forms. So the question was, is there a single form for single case agreements, or does that vary by CCO? So maybe let me ask both Jackson and All Care about if they either have or use you know, one form or file for single case agreements. So maybe All Care first.
From All Care, we don't have something that people fill out, but we do have an LOA process that we go through if we need to do that. As a reminder, though, we shouldn't need to do that since we have a contract with Prime Care.
Got it.
And Jackson?
Yeah, from our perspective, our network has not changed. So you should be able to continue to serve members as you had in the past without needing a single case agreement or any changes to your contract.
Okay, great. Let's see, where do we want to go next? Lori,
I have a question for each of the CCOs, and we'll start with All Care, but there was a question about when non-emergent medical transportation on the web will be updated. The answer, well, I guess we got an answer on the web or on our question answer form on our webinar. The CCO and searchable list are updated, and the map will be posted soon.
Okay, so we do have a few more questions. We've got about 4 minutes left, so we'll hit a couple of these. So another question for Jackson. You know, are there any discussions about JCC's current backlog for reprocessing claims, and then, you know, when taking on new members?
Yeah, we are working on it, and we are cutting the backlog as quickly as possible. So yes, we talk about it frequently, and we are working on it.
Great, thanks. Okay, we've got a couple time. Lori, do you want to?
I have another question here. Does OHA review CCO policies to ensure the spirit of their intent? And yes, CCOs submit their policies and procedures on a wide range of topics, and OHA does review and provide feedback to the CCOs.
Okay, a couple final ones, and then we'll close out here. So this is one that maybe on our end we're not completely sure and would need to check, so I may ask All Care and Jackson to comment. For disputed claims, is there a time frame a CCO is required to respond? And again, on our end, I can't remember if there was a specific note of that in contract, or if there's something that either CCO, you have that readily available.
Disputed payments, we respond generally within 30 days.
All right, I think we have, sorry, I cut off, maybe Jackson was trying to jump in there. Anything to add with that?
I'll just add, I think the definition of disputed might change the answer, but that information is contained in our contracts. So for, you know, specific disputes or need, it's what's included in those contracts that would rule those requirements. And
this is Lori. We can pull that from contract and put it as a in our FAQs. There also was a question around rules guiding CCO policies on working with providers on payment when CCO members are served and the provider has requested payment. So it's a similar type of question around disputed claims, and we can provide that in FAQs.
All right. Well, it is 12:59, so we still have a few questions that have come in. And so again, I think as we had mentioned, we'll do a sort of a Q&A for all of what we responded to, and post that so folks can see that information. I definitely want to send a special thank you to All Care and Jackson Care Connect for joining us on our provider webinar specifically for Jackson County. And to the provider community, thanks again for the service and services that you give to Medicaid clients, and look forward to keep working closely with you as we continue to move forward with CCO 2.0. Thanks.
Yep. Thanks, everybody.
Thank you.